This week, we've brought you coverage of wait times at emergency rooms. Many folks reaching out saying they are concerned and frustrated. Tonight, we spoke with a man who says his elderly mother-in-law has been waiting for proper admission for 36 hours. Christian Garzone joins us live now from Rochester General Hospital with more. Christian.
Well, Jack, Scott Wilmeth lives in Florida, but he and his family in Rochester here have been trying to get his mother-in-law proper admission at the hospital now, going on 36 hours. We're told she's in a hallway and just got her first meal this evening. Now, as we know from this week, hospitals are admitting they have backup issues at ERs across the region. Wilmeth says, though, he knows staff are truly doing all they can right now, given the circumstances. Scott Wilmeth says his 80-year-old mother-in-law, Lydia, has been in a hallway for 36 hours now at Rochester General, near the emergency room, with fluid in her lungs and some heart issues.
They haven't assigned her a room. Yesterday she didn't get, they didn't even bring her food.
Lydia, he says, is diabetic and has a language barrier.
She has no one to be her advocate. And so it's very concerning.
This week, the chair of emergency medicine with Rochester Regional acknowledged there are staffing shortages. He says if you don't have a serious condition, you might experience a delay in care.
Patients that need a kind of an intensive care unit or surgery or those kind of immediate interventions, I think you can expect those to run fairly normally to what we saw even pre-pandemic.
Wilmeth believing the vaccine mandates could be behind some of these staff shortages.
Very conflicting issue. People feel very strongly one way or the other.
Wilmeth grew up in Venezuela and says the wait times there are still nothing like they are here, even with Lydia's delay. But in the U.S., he says this shouldn't be happening.
This is not the way it should be. I know sometimes things can get backed up, but we're going on a day and a half now.
Yet, Wilmeth says to those working hard in the hospitals trying to hold it all together, they have his respect.
My heart goes out for the healthcare workers because I know it's been a tough go here for almost coming up on 2 years.
And we did reach out to Rochester Regional Health for comment. When we get that comment in, we'll update this story over at rochesterfirst.com. Live in Rochester, Christian Garzone, News 8. Jack, right back to you.
Christian, thank you. Rochester General announced yesterday they are building a new site to help expand ER patient care.